By the end of this module, you will understand how aging affects nutritional and hydration needs, identify and manage risks of malnutrition and dehydration, conduct thorough nutritional screenings and assessments, develop individualized, therapeutic, and culturally sensitive dietary plans, support hydration through behavior-based medical and educational interventions. Nutrition and hydration are foundational to healthy aging, yet they are among the most neglected aspects of elderly care. This module explores the biological, psychological, and social changes that influence dietary patterns in the elderly and outlines how proper nutrition can delay degeneration, improve immune response, strengthen bones and muscles, stabilize chronic conditions, and enhance mental well-being. The module goes beyond basic food planning. It critically examines malnutrition, dehydration, metabolic slowdowns, dysphagia, sensory impairments, dentition challenges, and diet-drug interactions. It draws from evidence-based global guidelines and emphasizes individualized, culturally sensitive, and medically aligned meal planning, especially for clients with comorbidities and cognitive decline. Physiological changes affecting nutrition in the elderly. Aging introduces several anatomical and physiological changes that influence food intake, metabolism, and hydration. Reduced basal metabolic rate, BMR, leads to lower energy requirements. Sarcopenia, loss of muscle mass increases protein demand. Decline in taste, smell, and appetite affects food enjoyment. Gastrointestinal motility decline, can cause constipation and malabsorption. Changes in dentition, missing teeth or ill-fitting dentures affect chewing. Decreased saliva production, xerostomia, impacts swallowing. Visual impairment can limit food preparation independence. Common nutritional deficiencies in older adults. Despite low caloric needs, elderly individuals often suffer from micronutrient deficiencies. Calcium, linked to osteoporosis. Vitamin D, essential for bone health and immunity. Vitamin B12, deficiency causes cognitive decline and anemia. Folate and iron, critical for hemoglobin production. Zinc and magnesium, affect wound healing and sleep regulation. Omega-3 fatty acids, brain and cardiovascular health. Causes include poor appetite, medication side effects, limited access to fresh foods, financial constraints, chronic illnesses like dementia, Parkinson's, or cancer. Hydration challenges and dehydration risk. Older adults often suffer hidden dehydration due to decreased thirst sensation, incontinence fears leading to fluid restriction, medication-induced diuresis, e.g., diuretics, laxatives, dementia or physical limitations that impair water access. Consequences of dehydration: confusion, dizziness, constipation, falls and urinary tract infections. Kidney dysfunction, increased hospitalization risk. Recommended fluid intake: 0.05 liters per kilogram per hour, 1.5 to 2 liters daily, adjusted based on kidney or heart conditions. Malnutrition screening and nutritional assessments. Tools and protocols for early detection. MUST, Malnutrition Universal Screening Tool. Mini Nutritional Assessment, MNA. Body mass index and mid-upper arm circumference. Dietary recall, appetite diaries, hydration logs, signs of malnutrition, sudden weight loss, greater than 5% in a month or greater than 10% in 6 months. Fatigue, muscle wasting, hair loss, edema, delayed wound healing. Multidisciplinary assessment involving dietitians, geriatricians, speech-language therapists for dysphagia, pharmacists for drug-nutrient interactions, therapeutic diet planning, and nutritional interventions. Nutrition must be tailored to individual medical profiles, cultural preferences, and physical capabilities. Low-sodium diet for hypertension, low glycemic index foods for diabetes, soft pureed diet for chewing, swallowing difficulty, high-fiber meals for constipation, renal-friendly diets for CKD patients, vitamin-enriched diets for cognitive decline or wound healing, interventions, point. Meal fortification, adding powdered milk, eggs, oils. Nutritional supplements, ensure glucerna. Enteral nutrition, NG tube, PEG for severe cases. Feeding assistance and social mealtime support. Hydration interventions and management, encouraging sips of water regularly, not just with meals. Use of hydration reminder devices or apps. Flavor-infused water, herbal teas, broths. Monitoring urine color as hydration indicator. IV or subcutaneous fluids in acute dehydration, creating a fluid chart for high-risk patients. Cultural, ethical, and psychological considerations. Respecting religious and cultural food choices. Managing refusal to eat in dementia and depression. Avoiding force feeding. Using positive reinforcement. Ethical concerns about artificial nutrition in palliative patients. Importance of communal eating and social connection. Supporting autonomy while encouraging healthy choices.